Okay, good afternoon, everybody. Welcome to our first inaugural webinar for healthcare providers. We're very pleased that there are a number of people on the live event, and we're thankful for taking the time out of your day to listen in and hopefully get some useful information. I'm hoping everybody can hear me okay. A few more people may be joining in as time goes on, and that's perfectly fine. And so just before we get started, I'll just do a brief introduction, some acknowledgements, and then a couple of housekeeping items, and then we will get to it. And I think we're slated to 1 o'clock today. So thanks again for joining. My name is Farine Karachuela. I'm one of the Associate Medical Officers of Health here at York Region Public Health. I'm a public health physician by training and do a bit of clinical practice in family medicine, very part-time, and actually not that much since COVID started because it is all-consuming for us, as you might imagine. This is one of the first times we've done a webinar like this. Hopefully people have seen our communications that have gone out since the start of this pandemic. And I'm hoping people have been receiving that as well as checking out our website. And I'll go over some key links and some important websites to be familiar with. But we thought it might be nice to have a bit more dialogue and engagement, and we have some questions to inform some of our engagement efforts right at the end. So if people could stay for that, it'll just take a couple of minutes, but we'd love to hear more from you about what types of updates you want and want to hear. And just before moving on, I just wanted to give a really big thank you to everyone that's been involved in putting these slides together, getting all the input. So thanks to Sarah and Brooke and Emily for a wonderful job. And thank you to Kelly, who's helping us on the IT end, which we're hoping will go smoothly. So next slide, please. This is just to note that the meeting will be recorded and you will have the opportunity to ask questions. I will be monitoring this and looking out for things that we can answer. And for anything that we may not be able to answer on the spot, or if there's a whole bunch of questions that come in, we will make note of them and we can send something out through our Public Health Matters newsletter, which I will show you how to access very shortly. You won't be able to see everybody else's questions, but I'll be able to see them, so I will try to summarize as we go along. And if there's any questions about the recording, there's an email on the slide there that you can touch base with. Next slide. So to ask a question, there's a Q&A button there on the right-hand side of the screen, and you can type the question and press send, and then I'll be able to see it almost immediately. And like I said, I'll read some of the questions out loud when the time comes, and I'll try to monitor it throughout. Next slide, please. So if you haven't already seen, you can go to our webpage for healthcare providers in the community, and it's york.ca/healthprofessionals. We do ask that people sign up for the e-newsletter because we'll be sending the slides through that forum and any follow-up FAQs that might come out of this through that as well. So you can see the little tile there that says e-newsletter for healthcare providers. So you just click on that and it's a quick subscribe. That's the best way to sign up. Next slide, please. So I just wanted to get a bit of a sense of where people are listening from and what's your practice environment and really who you are. So if you could use that live event Q&A button to just type in some responses and I'll summarize quickly. So if you can just type in some answers to the first question, just curious to know where people are joining us from. So which municipality in York Region, or if you're outside of York Region, just curious to hear where you're from. I do see a question that's come through, which I will actually answer in the testing section. I'll just give it a couple more seconds. Okay, so I see some people are joining from Markham, Aurora, Vaughan, King City, Markham, and I've asked as well what your field of practice is. So if you are in a specialty, if you're pediatrics, dentistry, family medicine, etc., and curious to know as well what your role might be. So we have quite a few. Newmarket as well, a few physicians, some folks in occupational medicine, some GPs, folks from Richmond Hill, and some pharmacists. Great. physician, occupational medicine, that's wonderful. I imagine there'll be some questions about return to work, which we'll go over. Etobicoke, Vaughan, Aurora, wonderful. Folks in family medicine, great. Okay, so thank you so much for answering those questions. We will move on to the next slide. So as I mentioned, we tried to really gear the presentation around what people had wrote into us before, try to answer some questions that have come up, some commonly asked questions from our physician intake line, as well as key topics that people wanted to go over. So we'll keep it very focused to that. I did want to have a bit of a discussion briefly about what our roles and responsibilities are. So I think there's not always the greatest clarity between what does, a body like Ontario Health do versus Public Health Ontario versus the ministry and ourselves. And hopefully that'll help with directing questions the right way too, because we are a part of a pretty massive system with a bunch of different bodies. So next slide, please. So you can see from here that our public health system and our acute care system are a little bit separated. There's some overlapping roles, but we have an entire kind of public health infrastructure that's a little bit removed from other bodies like Ontario Health, the hospital sector and clinics, for example. And actually the Ministry of Health sort of toggles between the two. So from the public health end of things, at the federal level, we have the Public Health Agency of Canada, which I'm sure many people have heard of. In this pandemic, they've been mostly responsible for setting guidance documents. They have a number of federal tables. So they have the public health, the advisory committees, technical advisory committees, who really are made up of a bunch of experts, scientists, public health experts, epidemiologists, who tend to inform a lot of the provincial tables, and they will talk about guidance from, the modes of transmission or masking policies. They'll kind of put their heads together and advise provinces accordingly. The feds also deal with things like anything to do with international travel, border closures, quarantine from people coming into the country. Then at the provincial level, we have, of course, our Ministry of Health. That really sets the policy direction in terms of, testing and guidance on all of the guidance documents, really. So for the acute care sector, for hospitals, they've produced a number of those, and they really make all the policy recommendations when it comes to things like reopening as well. Public Health Ontario is an arm's length government body, and they are sort of the scientific arm that informs Ministry of Health. And there is a provincial table too called the Public Health Measures Table, which helps provide some input to the minister on things like reopening or what will happen with schools, for example, in the fall. They provide a bit of input, and then of course the minister and the various cabinet will make its decisions. At the local level, which is where we are, York Region Public Health, we're one of 34 health units across the province. And so we don't produce sort of the guidance documents or anything like that. That all comes from the ministry, but we are doing local implementation as well as our main activities, which is case management, contact follow-up, managing all the outbreaks in the various settings, so long-term care, retirement home, group homes, and the rest. And we have a large role to play when it comes to local surveillance, all the epidemiology, and feeding that up to the province so they get a good sense of what's happening locally to advise their decisions as well. And then we have Ontario Health in the acute care sector. So some of the roles that they're primarily responsible for, sometimes in conjunction with the Ministry of Health as well, are things like the proactive testing. So they've been very involved in those targeted testing campaigns for workplaces and other higher risk sites. And they also very much deal with the PPE supply. So I know some questions have come up as well around how to access PPE, and that's all through Ontario Health and Ministry of Health partners. Okay, so next slide, please. Perfect. So just to go over what some folks are responsible for in the community and how you can sort of best support some of the preventive efforts. Starting with what we do. So like I said, we're predominantly involved in the case management side of things, contact tracing, contact follow-up. We make very sure that we make contact with new cases within a 24-hour period and give them the advice around self-isolation, do a very detailed history around who are the contacts, who are the close contacts, and what advice they need to have. And then very involved, of course, in managing all the institutional outbreaks. And there were many of them at one time. They're kind of quieting down a little bit now. And then, of course, we provide quite a bit of support around infection prevention and control. And in terms of the healthcare provider role, there are several things that, like I said, you can do to help with some of the preventive efforts. Mostly remaining up to date with the guidance documents from the ministry. I'll show a link after where all those things can be accessed on our website, but also on the Ministry of website if you're not already familiar. So that's like keeping up to date on the most recent case definition and guidance documents from that end. And then we get a lot of questions around reporting, when we want to hear from you, etc. So for the most part, we wait till we have a lab confirmed case before we do the contact tracing and case management and follow-up. There are some situations where we might get involved earlier, and that's if someone works in a very high-risk setting or we know that they're a probable case. So for the most part, the labs are the ones that tend to report to us if there's a lab confirmed case, and it's sort of automatic mandatory reporting under our legislation. But we do want to hear from clinicians, physicians, anybody in the community when there's somebody who's actually a probable case. So probable meaning they have an epi link. And they're symptomatic. So they do have some kind of signs and symptoms, and maybe they are a close contact of a case, or they work in a place where there's an institutional outbreak, or they've had a recent travel history from outside the country. In which case you would want to contact us. We encourage filling out of our reportable disease form, which is all on our website, which I'll show you as well. And if you could provide as much info when reporting, that's wonderful. So there's a little note section. And really what we're wanting to know is a person living or working in an institution, long-term care home, retirement home, group home, shelter, so that we can identify an outbreak as soon as possible and start putting into place all the control measures. And then also whatever details you might have around their acquisition source. So again, if they are a close contact of somebody, if they've had this travel history and might have gotten it overseas, that would be really helpful, as well as the type of symptoms and their onset. So sort of whatever you've obtained in your clinical history, as much of that you can flesh out in the notes section is really helpful. All right, so next slide, please. I wanted to put forth a few messages that healthcare providers in the community can emphasize, because you're often the ones with a very close relationship with your clients and are always a trusted source of information. So some things that you can help us reinforce if you have the time and space, and I know that's not always the case, but if you're sort of guiding a client or they're asking you questions, you can always also direct them to our website, which I'll show you a link to as well, but it's York.ca/COVID-19, and there's a lot of user-friendly information for clients and their families. So of course we want people and clinicians in the community to reinforce the preventive messaging, and that's the continued ongoing hand washing, regular and thorough, environmental cleaning of high-touch surfaces, of course the physical distancing of 2 meters and doing that as much as possible, and really staying home if they have any sort of symptom. We also want that you reinforce the sort of isolation advice, so people staying home for 14 days if they are a confirmed case, and I will go into that guidance as well, because I do see some questions coming up about that. And then explaining things, because we find that the public may not always be up to date on, and it's also sometimes confusing messages around social circles and who's in your bubble, and you can only be part of one bubble. So answering those questions or having that come from a trusted health professional is always helpful. Eventually, and you might have heard about this on media as well, but Ontario and actually Canada-wide, they will be rolling out a contact management tool, will be called COVID Alert. So when that's all live, we'll need quite a bit of help in promoting that. So the more people that are on that, the more effective it'll be in terms of helping the contact tracing efforts. And we'll send out more alerts once we have a bit more info on that as well. And then very importantly, I mentioned the acute care guidance document and the primary care guidance document, and your own regulatory colleges may have this as well, but really being diligent about following those things. So if you have a waiting room, making sure you're following that physical distancing in the waiting room, have a registry of what patients you're seeing. So if there's any contact tracing that needs to be done, we at least have who was there on that date and for what and for how long. And then doing the environmental cleaning in your own environments and practices, and of course making sure you have some sort of system of screening your own employees and yourselves and are really staying home when ill. And then of course the whole screening practices as well, and being diligent about following that. Okay, so next slide please. So we did get some questions around what the current epidemiological situation is in York Region. So I'll spend just a couple of minutes going over some key trends that we're seeing and some questions that have come up around that. So next slide, please. This is our most up-to-date epidemiological curve, and you can see it from week to week since the start of the pandemic, really in mid-February. You can see that we are trending down, which is really good news. So things are getting better in this situation for sure. At the peak of the pandemic, we were probably getting about 50 or so new cases a day, and we're now getting closer to 12, which is nice. And our current incidence rate, so rate per 100,000 is 9, meaning of every 100,000 people in York Region, about 9 people are getting the infection on a time span of a week. We roughly have about 8 to 10% of the provincial cases at any one point. And so in York Region in total, we've had about 3,000 cases, very rough numbers, and around 250 deaths. So what I thought was interesting about this is you can actually see the acquisition sources here. So whether someone actually got COVID-19 because they were a close contact of a case, that's the purple color there on the slide, which you can see is actually the bulk of why people are getting it. If they were living or working in an institution that was in outbreak and that was the source of acquisition. So you can see actually in the height of the pandemic, that was the bulk of the cases were from our institutional outbreaks. Then there is people who have traveled and gotten it, which you can see is quite a small amount, especially now, that's in the pink. And then if people have gotten it through local transmission, which is really, we haven't been able to identify who the close contact is or exact acquisition source. And then workplaces, which are also a minority of cases, but we are seeing, you know, as things were sort of opening up, a few more workplace outbreaks as well. And then you can see a little link there to our dashboard, which if people are interested in further numbers, what are the up-to-date death counts or anything like that, you can go to York.ca/COVID-19, and there's a little tile that says COVID-19 in York Region. It's an interactive dashboard and will be very helpful. And I do see some questions around the mandatory masking, and actually we're going to get into that next. So next slide, please. We did get some questions because you might have been hearing on the media, or one of our medical officers of health, Dr. Kourji, who's does his weekly or actually twice a week updates to the public, has mentioned this as well. So over time, we are seeing since about the end of June a slight upward trend in the number of cases in kids, so people 0 to 19. And you can actually see just from the age breakdown there, the bulk of those are actually in the more teenage years, so 15 to 19-year-olds. And we're still looking into the reasons for this. You know, some of it might be related to reopening or youth going out more. But when we actually do the analysis of where these teenagers are getting it from, it does seem to be very consistent with the rest of the public, which is they're getting it mostly from close contacts. So they tend to be, and I heard this phrase on our emergency ops call today, but which is consistent with a bunch of the reviews that we see around children, is they do tend to be the victims, not the vectors. So they're not often, at least in the cases we've been looking at, more recently, they're not often the index case, but they tend to get it from other people and don't seem to be sort of super spreaders or anything like that. But although we know the evidence is sort of mixed on that, and luckily kids tend to not get very sick from COVID-19 for the most part. And then you can see the sort of age pyramid on the right-hand side, the yellow and green curves there. You can still see that the bulk of our cases are in the older age group still. So those sort of 40 to 44, 50 to 59. Okay, so next slide, please. So I wanted to go over a couple of things that have been new over the past week. Next slide. So, as I'm sure everyone has heard, starting tomorrow, face coverings will be mandatory in indoor public places in York Region. Indoor public places are encompassing over a number of different things. So they do include community centers, libraries, commercial retail establishments, banquet halls, and faith-based settings as well. And really it's anywhere that isn't outdoors where you can't maintain the 2 meters of physical distancing. A couple of things to note with this. So a face covering has a pretty broad definition. It's not just a mask, but it can be even a bandana or a cloth. There are exemptions, of course, that are allowed. So anybody that's less than 5 years of age, we're saying it's not required. Anyone that would be compromised because of any sort of medical condition, if they can't put on or remove the face covering safely, then of course they would be exempt, and really anybody else that might have an exemption under the Human Rights Code. And we're not asking, or no establishment would be asking for proof of this type of an exemption. So nothing needs to be, there's no notes needed from health professionals or anything like that. And actually your own practice environments would be exempt as well, because you're, regulated under a different college, so that becomes a jurisdictional issue. If you're looking for more info too, you can visit our new site. So it's York.ca/mandatory masks. And really the onus is on an establishment to have a policy in place. So we wouldn't be the idea is more along the lines of education, not really enforcement. And the idea is establishments wouldn't have to turn somebody away, but more like provide a verbal reminder or some education as somebody walks through the door. So it's really not meant to be punitive in any way, and nor can an individual be, fined or anything under this instruction that's been issued. So the question has come up quite a bit on face shields. So people who would wear a face shield because they can't wear a mask because of medical reasons. Will people have any issues with that? So really the most up-to-date advice from the WHO is a face shield is not an adequate substitute for a face covering, but it is better than nothing. So we would encourage people who cannot wear face coverings because of very legitimate medical reasons or otherwise to wear a face shield if they have one. It wouldn't necessarily afford the same amount of protection, but it is better than not having any barrier. So that is totally fine. And again, the idea isn't that anybody would be turned away from an establishment because of this, but more provided that verbal reminder, post signage, and we'll be complementing this with some education efforts as well, because of course we want people to know how to don and doff them properly, washing their hands before and after putting it on. Okay, next slide, please. So another thing that is new in York Region is we are collecting race-based and income data as well. So this is a provincial initiative actually, and so all health units across the province will be collecting the same information. And really the rationale for that is because we know that COVID-19 has not affected all populations equally and has sort of exacerbated some existing health inequities. For example, we know that across the province, from the various analyses that have been done, the rates of COVID-19, as well as actually hospitalization rates, are higher in areas of higher material deprivation and lower income quintiles. And also in more diverse neighborhoods, there tend to be higher infection rates and hospitalization rates. So we're really collecting this information so we're able to tease that out a bit more and help direct interventions to improving health for all in our communities. And I did get a question I see on the right here about what is the R0 number in Ontario. So it's been fluctuating since the start of the pandemic, and nowadays over the past several weeks it is hovering around 1, and in York region we're just a little bit below 1. So that is very good news and indicates, you know, slowing of the spread, and also that our interventions are more effective, which is. And then I see a question as well about why offices of health professionals are exempt. So really the main reason is because your regulatory colleges have issued various guidance documents, as well as the Ministry of Health, around what the PPE requirements are, both for the health professional themselves, as well as what things you can do in your own practice settings to ensure things like physical distancing and cleaning. So it's really just a jurisdictional issue, so as to not get into contradicting regulatory bodies and things like that. But of course, any practice, which is its own business, can set its own requirements when it comes to face covering use from people that are visiting. And then of course you would follow, as a health professional, your own regulatory college's advice about when to use what type of face covering. And for the most part, our ministry is saying, you know, you would do a point of care risk assessment and go from there. Okay, so, and I just see a question as well about what is the evidence of kids spreading the virus to adults? And the person's asking the question because of the whole return to school issue, which we'll go over as well. So the evidence has been mixed on this, but the more recent reviews that we've come across now is that, you know, so kids tend to not get as sick. And for the most part, they seem to be the receivers of the virus. So again, this whole thing about them being the victims, not necessarily the vectors. So they aren't thought, at least for more recent reviews, to be spreaders necessarily. And we're kind of seeing that as well with our most recent handful of kid cases. We see that they've actually gotten it because they live with a person who's a case, as opposed to them actually being the index case, giving it to other members of the family. Okay, so we'll move on to the next slide, because I imagine this is something that has come up in people's minds as well. So a whole bunch of questions around airborne transmission. So you may have seen that some scientists wrote some letters to the WHO about the possibility of airborne transmission. So I believe Public Health Agency of Canada and some of these provincial and federal tables are looking into this and will be probably providing a response. But really what's being communicated to us is the fact that it's not necessarily a dichotomy. So it's not that the virus is all airborne or all droplet contact. And really it's more of a spectrum, which we see with other diseases like influenza, for example. I think the studies that have been cited, they could show that there's virus particles in the air, they can linger in the air. So it's very plausible that they could be detected. I think the question, which still remains to be answered, is how infective are those actual particles that are being detected? And from everything that people are seeing when it comes to the R0, when it comes to even a secondary attack rate, we know that this virus, the R0, is more in line with influenza. It is more that household attack rate is quite low. And so it's not really behaving from the transmission dynamics in the actual communities in real life experience into it being more like a measles, for example, which is airborne. So I think this is going to continue to be researched, but for now I don't feel that any of the measures are really going to be changing too significantly when it comes to the physical distancing advice or the masking advice, for example, in the population. And actually, if anything, more attention might be paid to things like ventilation strategies, which is good for chronic diseases as well, right? Like paying attention to the indoor air quality. All right, so next slide, please. So we're going to go over a few things with regards to testing, and I see a few questions have come up with that. So next slide. This is our provincial testing framework. So there's the whole piece around assessment center testing. So people who have symptoms, people who are contacts of a case, People who are worried about exposure are always encouraged to go to their assessment centers, and usually those are run by the hospitals. And then you have the outbreak management, and that's the domain of public health. So we might order for all residents in a particular home that's an outbreak to be tested. Ontario Health, like I mentioned before, is more involved in the targeted testing campaigns. So for higher risk groups like farm workers, other workplace settings, they've been doing this sort of surveillance testing to see what the positivity rate is. And actually they found that it's been quite low. So mass testing of asymptomatic people may not be yielding too much. I've put the link in there to the provincial testing guidance, which is a good thing to be familiar with. Next slide, please. So this question has come up quite a bit. So we are saying that asymptomatic close contacts would be tested. And the question came up about if somebody tests negative, why would they still have to fulfill the 14 days of self-isolation? And really, we have to keep in mind that testing is not a panacea. It just reflects one moment in time. And we know the incubation period can be up to 14 days. And so even if somebody's negative on, say, day 2 or day 3, there's still quite a bit of time that would go on where they could turn into a positive. So we're not necessarily saying get tested multiple times through your incubation. The idea is to get tested once to see if you're actually a contributing case or have already gotten it and it's been unrecognized, and otherwise you fulfill your full 14 days of self-isolation. I see some questions too about if you're thinking somebody is exposed or they're high risk and they test negative, can they still go back to their usual activities? So the idea of that pre-test probability is really important. And also just want to note that we've asked Public Health Ontario Labs this question a number of times as well, is what are those sensitivity and specificity values? And they're not that well documented yet, because it does require a gold standard of culturing to actually measure how good your test is. And that can only be done in very precautionary labs, like at NML, for example, in Winnipeg. So those estimates we don't have a good handle on yet. But you would use your clinical judgment. So if somebody doesn't have a clear exposure, they're not in a high risk setting, they have symptoms and they test negative, the guidance is that they would continue on with their regular activities. If you as a clinician are very suspicious, maybe they've had contact with a confirmed case, they're very symptomatic with compatible symptoms and they test negative, then yes, it could be a sampling error or a false negative. And in that case, you might want to resample. And that would be a good time as well to call into our line, get some advice around self-isolation also. But if in doubt and you're very clinically suspicious, you would ask that person to self-isolate until further testing or investigation can be done. And just one other thing to emphasize in the testing or guidance documents is that you wouldn't retest positive cases. And I'll talk about the clearance as well. But really, people can continue to test positive even if they're not infectious, because the test is actually very sensitive and could pick up dead virus still. So that's why the province has moved away from continuing to test for the purposes of clearance, more towards a time-based approach. Okay, so next slide, please. Okay. And sorry, I do see a question as well about if a person has no exposure and no symptoms to COVID-19, but they've gotten a test, why are they told to isolate until the test results come in? So there is a quick reference guide on testing, which I have a link to actually in a little bit. But if a person is just being tested proactively and they've had no exposure, they are not recommended to self-isolate until waiting for their test results. So we would only be doing that if they've actually, they're part of an outbreak or we're worried about exposure or they've had a close contact, in which case they would be self-isolating beyond their test date, whether or not it's, even if it's negative because of that close contact. And that advice hasn't changed of self-isolating after last exposure for a full 14 days. But if it's a completely proactive test or they just got it because, then they usually do not need to self-isolate. Okay, next slide, please. So a few things that have changed when it comes to the asymptomatic positive cases. We are seeing these more and more. And actually what's happening is we usually ask for a retest because it could represent a more remote infection. We tend to get a CT value from the lab, which stands for cycle threshold. If that value is high, it can usually indicate lower transmissibility. So typically in the face of no exposures, a totally proactive test, if somebody has no symptoms and test positive, we get the CT value. If it's high, we tend to retest them. And if they're negative on that second test, then for the most part, we're advising that they can go back to their regular activities. Next slide, please. So we did get some questions around why a 14-day isolation period, because there's some other jurisdictions that have 7 days, some have 10. So this is based on the advice from Public Health Ontario, which again looks at the body of evidence and literature and advises the Ministry of Health accordingly. And there were some reports of, upper end of the incubation period being between that 10 to 14 days. So that was the advice that Ontario went with, is the full 14 days. I don't know if that's going to be revisited at any point. I think that's come up a couple of times, but for now, this is what we have and what we go with at the local level as well. And now in terms of the clearance guidance, and I put the link there for the quick reference guide, which is a very helpful resource. So the province has really moved away from any test-based clearance. They're not asking that people get retested again. Some occupational health departments may ask for swabs to be negative, so maybe they'd ask for 2 swabs to be negative 24 hours apart. For the most part, we are not recommending that anymore because we know now that the test is quite sensitive and again could be picking up sort of dead virus. And really the idea is 14 days of isolation from the first symptom onset, pending that there's clinical improvement and a person is afebrile. Okay, so next slide, please. I know there's been quite a few discussions going on about school reopening, so we wanted to address that briefly too. Next slide. So, I mean, the short and long of it is we don't know yet what the final decision is. The ask was that the school boards come up with some plans for different scenarios. So, a full day return to school, a hybrid model, or totally virtual. And Public Health's been involved in providing answering questions, doing a bit of input and advice on the plans. I believe the plans are due to the province August 4th. And then really it will be a central decision from the Ministry of Education with the Ministry of Health and Public Health Measures table weighing in. So we're thinking that there would be an announcement soon. And I know we've talked a little bit about whether kids are vectors and able to easily spread. And again, the evidence is somewhat mixed on this issue. So that's all I'll say about that. Next slide, please. And next slide, please. So I'll just go over a bit of what's happening with regards to reopening. And again, most people are probably aware that as of Friday, a bunch of different areas in the province, so 24 of the 34 health units will go on to stage 3. And really with stage 3, there are higher limits on social gatherings, so 50 people indoors, 100 outdoors, still maintaining the distancing, of course, if you're not within a social bubble. And a lot of the remaining businesses and public spaces will open, except for things like amusement parks, clubs, overnight camps as well would still be excluded. And so York Region is actually one of the health units that will not be moving to stage 3 as of Friday, and so we're just waiting for further info about that. Next slide, please. In terms of the guidance for reopening, so there are a few documents that we've linked to here for you to take a look at. A lot of the specifics around elective procedures, what can open at what time, is coming out of Ontario Health and the Ministry of Health, but mostly through Ontario Health. And these are the couple of guidance documents that I mentioned. So that first one, specifically for primary care providers, hopefully people are familiar with that ministry guidance document, and it really goes over all the requirements when it comes to screening, what to do in the waiting room, how cleaning should be done, PPE use, and things like that. Next slide, please. I did want to go over some important resources. So next slide, just so you have an idea as to what you might want to bookmark. And when we send these out, you'll of course be able, they're hyperlinked, so you can just click on it. So our health professionals site is very helpful, and we have a link to all the other ministry guidance documents there as well. And our York Region dashboard as well. The link is provided there. Public Health Ontario has a number of very useful resources. So they'll summarize some very key scientific articles. They have some evidence briefs around, what's new with kids, what's new with, mask wearing, and they'll just do these brief reviews of a whole bunch of different literature and summarizing that in a nice, easy to understand way. And of course, there's the Ministry of Health webpage. It's sort of a longer link to get there, so it might be easier just to click on it. But that's where you can see a whole host of guidance around, visitation policies and long-term care, testing guidance, what's the up-to-date symptoms list, and case definition, which we've been encouraging people to take a close look at. Next slide, please. Okay, and then of course, we're always available to answer questions. We have a dedicated health professional line. The extension is there at 77280. There's an after hours number as well if you're reporting in anything, and you can always direct your clients or patients to our website as well. So next slide, please. We just have a few minutes remaining, so I wanted to ask if you are able to type into that Q&A box. Next slide, please. The answers just to some of these questions. So feel free to take a read through, but we'd be very interested to know how useful this is, if you learned anything new, other topics or questions. And again, we'll take stock of the questions because I think there's quite a few that we probably didn't get through, and we can send out a follow-up document through our Public Health Matters listserv. And just in the future, is this time good, duration good, and in an ideal world, if we had all the capacity in the world, how often you might want something like this? Would it be once a month or every week or something like that? And not committing to anything, but we would love to hear how we can better engage. So I'll pause there for people to type, and I'll just do a scroll through to see if I can answer anything else really quickly. I do see a question as well while people are writing just about whether we advise to wait a few days if somebody's getting tested because they're a close contact of a case. So the guidance does say get them tested as soon as possible and then at some point within the 14 days. But we heard from the province that sooner is better just because they may have been index case or contributing to infection. So they're still finishing their 14 days of isolation from last contact. So the sooner they're tested, the better. And people might have anxiety about waiting a longer period of time. They're getting some questions around the rationale for family members of long-term care residents to have a negative test within 2 weeks. It's a very good question. We've raised that a number of times with the ministry, because it is sort of putting a lot of reliance on testing, which again, we know is just a one moment in time situation. My understanding is that they are in the process of looking at this more closely and revising, and actually something new just came out today, which we can disseminate. And I think that requirement, they're looking to have that change. And thanks to those that are providing some feedback and how often you'd like to have this. I see a question too around if kids are more recipients of the virus and not spreaders, what happens if they return to school? Because we know the incidence of colds are much greater, and will they be spreaders? I think that's a really good question. A lot of that remains to be seen. I think the decision around school reopening is definitely not an easy one, and there's lots of things to consider. But I think the incidents and things like that would be tracked carefully, as are things like what will now be the incidence of things like flu. Okay, a lot of people are saying once a month. That's great. So I see it's coming up on 1 o'clock. So we will, like I said, take stock of all the questions. Anything that hasn't been answered, we will send out through our Public Health Matters newsletter, so please do subscribe. And we'll take into account all this feedback and hopefully schedule something in the future. Thank you everybody for joining in.